we have some young learner who would like to join us. Okay, so good evening, everyone. You all can see my screen, I hope.
Yes.
Okay, so yeah, so tonight we're gonna talk about forgetfulness or dementia. Before I share my screen and begin the didactic sections, just want to remind you that next week we will be off because Independence Days in Vietnam and also Labor Days in the US. So I will have my next sections a week later. So don't forget. Anyway, I hope that I will have some of the exercise for you to keep you engaged. A short one, so don't worry, you still have time to enjoy your day off, but hopefully we keep you warm and entertained and engaged for the next sessions. All right, and also thank you for participation in the warm-up sections. I hope that by doing the exercise, you have some idea about what I'm talking today. Dementia in general is a huge sections and cannot be crammed into just 30 minutes. However, I hope that I can give you the gist, the basic thing, so that when you encounter a patient with memory issues, even if you not work in geriatrics area, at least you have the basic to advise the patients properly and give them the proper guidance to what to do next. All right, so let's start. So dementia, these sections we talk about understanding it, what is a sign and symptoms, and we will save the counseling, the management for the next sections. There's many sources for information. I just pick out one of the simple and clear sources to present here today. Is from Mayo Clinics, and I have the link here for you to look up if you would like to get more in details what I'm talking today. So dementia, the definitions is here is a decline of the cognitive capacity, 2 or more. So that excludes people with problems, mental retardations since birth, right? So they used to be okay, and then it's decline. And more, 2 or more. So it's not just some features get affected, not just because they cannot say, that means they have cognitively impaired. They have to affect the brain certain way to affect more than the capacities. And is about the functions. So people cannot perform certain functions, but it's not because they decrease their alertness or their attention. You will see more about this later on when you need to tell one from the other. For example, people with depressions, we know that when people get depressions, they kind of don't really care about what's going on. The attention is much less. And when you don't pay attention, when you don't register any information, then definitely you won't be able to remember and to participate properly. So from the definitions, if you know or remember the basics about the definitions, it helps a lot in the future when you try to figure out what the problem is with dementia. So again, it's the groups of some symptoms affecting memory, thinking, social abilities, and it's got to interferes with your daily life. And of course, it's may caused by various disease. I have the pictures from the Alzheimer Society website. And again, it's the dementia is the umbrella, it's the big terms. It's not a disease by itself. It includes several conditions that we're going to talk about later on. So even though memory loss is a common symptoms and Alzheimer's is a primary cause of the dementia of this group of conditions, we still have many other conditions we need to pay attention to. So common symptoms include memory loss, communication issues, have issue with the space, time. That's why people get lost easier when they have dementia. And they have trouble with complex tasks, cannot figure out what, when, how to do what. And beside that, directly or indirectly, they have some personality shift. Some conditions may make people decrease their normally we have the balance between what we want to do and what we should not do. Like when you're out in the crowd, if you see a beautiful flower, you don't just go and grab it, right? So we have some social restraints, social constraint. We know what we can do and we cannot. With the depressions, with the dementia, certain conditions that moral, that's the way we control ourselves is removed. Certain conditions also go with agitations, and also certain conditions go with hallucinations. By asking these features, you will be able to tell more about which one is which one. The main cause is brain cell damage or lost. We're going to group these dementia condition into certain groups so that we make it easier for you to try to figure out which one is which in the future. So the biggest group over here, this is the first one, the first warm-up I asked you, and within this group is cover majority of the dementia conditions. I think if you go home and forget everything, at least in this group of dementias, remember these conditions. Alzheimer disease, the most common cause is that. Genetics and protein factors is having a role, but you will remember, you will hear about plaque and tangles. This is the word you're going to hear about that in these conditions. Vascular dementias is the damage. Stroke is obviously when you got the brain got damaged from stroke, then it's more or less going to affect the brain functions. Lewy body dementia, these conditions, especially the hallucinations, is a special feature of that. Besides other movement conditions that may confuse you with Parkinson. We talk a little bit about that in the future. And frontal temporal dementia. These conditions, the patient have the problems with the control. So I have a patient that have these conditions. He kind of have no control of his behavior, and he's also cannot realize the real life and not real life anymore. So his daughter kind of feel embarrassed when going out with him, bring him to the clinic because he's blowing kisses to all the nurses, and even at home he's flirting with the lady in the television. So he cannot tell real life reality anymore, and he's have no limitations about what he should or should not do anymore. And of course, you cannot just have one conditions. You can have more than one together in the mixed dementia. Other conditions go more in details. You may not see that very often in daily practice, but it's good to know about Huntington disease. It's a genetic conditions. Traumatic brain injury here. In the US, playing football, boxing, those sports that may cause some trauma to the brain, to the head, may affect that. Creutzfeldt-Jakob disease, this is the infectious protein here, and the Parkinson disease. That conditions start out with Parkinson's, but this can lead to dementia as well. And the next thing I would like you to take home with is some conditions with dementia-like, but then it's reversible. So majority of the dementia patient coming with memory issues turn out to be Alzheimer or certain form of dementia that's irreversible. But hopefully, even this number is small, but hopefully if you pay attention, if you look, then you can help identify certain patients with this reversible condition and can give them their life back. Some of the things we see commonly, like endocrine issues, people with uncontrolled hypothyroidism, for example, subdural bleeding. I have the patients in during my residency. He fell. He has slow bleeding in the brain. So initially, right after he came to the hospital, after he fell, the initial scan did not show anything. He came home. He went back home, but gradually the behavior, the memory changed, and when he's back after a few months, turned out he had subdural bleeding, and he recovered pretty dramatically after the surgeons remove the blood from his brain. So certain conditions, if you pay attention, you can help the patient. You can really save the patient. And as I mentioned earlier, there's some quick and dirty type of not dirty, quick and easy way to tell one from the other. That by just looking at the patients, very simple way to tell. If patients moving around, behave easy, comfortable, fast, then it could be the frontal temporal, more about the behavior, or the Alzheimer dementia. They function quite normal. And if the onset is younger, then more likely frontal temporal, older than Alzheimer, 60, 65 or more, likely Alzheimer dementia. Frontal temporal tend to be younger. And if you go further in the features, the behavior, disinhibitions, then you can tell about these groups. On the other groups is people slower. We have Parkinson's conditions over here, and of course people with history of stroke, then you can tell by the way they move. It's vascular dementia. And in Parkinson's, in this group of Parkinson, we talked about earlier that sometimes it's difficult to tell if it's Lewy body dementia or Parkinson's disease. Then you can tell by asking the story. Again, no test no scan, no blood test, nothing here. Just by asking story, you can tell from most of the basic conditions. Anyway, it's also the chance to tell you about this podcast here, the Curbsiders Internal Medicines. It's very interesting, very good podcast. If you have good English, I think you should start listening to this podcast. It's very practical and yeah, a very good source of information that you can use in your daily practice. And if you are attending, if you are teaching students, it's also a good source for you to come up with some questions to ask your student about medicines. All right, risk factor. This is the second thing I asked you about. You can see over here, and you list pretty good common risk factor that we normally see. So I won't list this thing over here again, but let me bring you to the next slide. So a few years ago, initially 2017, and then they revised it in 2020. Lancet published this study showing the certain risk factor that may affect the memory. And you can see that they estimate, all these estimations, 60% still unknown, but 40% they say potentially modifiable. Of course, as my age right now is a little bit midlife, hopefully still not later life yet for me. Certain thing I hope that we can avoid. So hopefully, not just for me, for us in general, we have good enough education. So that 7% is we can't cover. Hearing loss, I'm gonna talk more about it later. But hopefully no one have traumatic brain injury. Hopefully you got your high blood pressure check and control. Don't drink too much alcohol and pretty stay fit. So hopefully these conditions get control. And also smoking, depression, social isolation, physical inactivity, air pollution, diabetes, these conditions. Hopefully you have its control avoided altogether. Yeah, I zoom it up over here for you. And you can see it's over here. Air pollution is the new thing that they add onto that. I don't know how much we can control it. Hopefully you can do something to help at least improve the conditions you are in. But about the hearing loss, we don't pay attention that much, right? But it's turned out it's the big factor over here. There's several theories about hearing loss here. There's a new study coming out about people trying to see if fixing the hearing improve the memory or not. The results is quite interesting. If you can look it up, it's the I hope I can show you the link of that study, and you can read it up for yourself. All right. So complications, its impact on the body is at the initial stage. It's start with forgetting. If people don't have good relationships, then it may cause some discomfort within the family. If you don't know someone have problem with memory, or not aware that people have problem with memory, you're gonna easily get annoyed if someone keep asking you one question over and over and over, right? You get annoyed about that, and then some people start suspecting you to steal their stuff, steal their belonging because they misplaced it, and it's create really big challenge in the relationship. Later stage, people can have problem with eating, problem with swallowing, cause pneumonia, don't care about themselves. They may get lost, they may fall, and yeah, later on, it will be more about the medical issues. Preventions. We know about the risk factor, so here the preventions. you see the list of preventions that you can consider over here. Pay attention to staying active, staying physically active and socially active. So there's some studies showing doing Tai Chi, the exercise that you have to remember the move and practice in the groups really help with memory. But you don't have to be that complicated. Just go out for a walk with your friends, with your family, talking, discussing. That's also good enough. So don't keep everything to yourself. Stay out socially engaged. That helps with your memory. And yeah, make sure have good diet and take good care of your heart. Before we move on to the exercise, to the practice, let me give you some heads up about what you're gonna pay attention during the practice sections. So for the memory issue, people come with memory issues, you will need to pay attention to certain area to ask. First, just like any condition, any medical conditions, you should have a good pictures of the condition, right? When does it happen? How is that? How bad is that? Which situations? Yeah, like I showed you earlier, just by timing, if the tremor happened before the memory loss, then it's likely Parkinson. If the memory happened together with the tremors, with the hallucination, then it's likely could be Lewy body. Yeah, if people have the stroke beforehand and after stroke and gradually memory loss, then vascular. And people, if have nothing at all and the memory declines slowly with time, then yeah, Alzheimer dementia. So we got so in these areas, just sitting down, talking to patients, this give you a lot of information that you can make your diagnosis later on. The cognitive domains over here in memory, in dementias, we definitely talk about the memory, but also language is the area that affect people. So there's a joke that hopefully help you remember that language is part of the conditions. Is that an old man's always appear nice to his wife, say calling her honey, love, and his friends keep asking why is you after all those years still be so sweet to your wife, and he finally confessed that forget her name 10 years ago, and I'm just cannot bring myself to ask her name. So that's why I instead of calling her name, I calling her honey and dear and love, because I forget her name. So attention, language, people may forget certain language, and certain things that we use all the times that we don't remember, like the elevator in English, for example, people may say that the things that go up and down, the pens, for example, just that thing that help you write, things like that. So people may forget what it is. Attention is one of that thing. Executive functions, how to plan things, how to organize, how to follow instructions. Perceptual motor. I put the pictures of Aria over here using the fork to comb her hair. To help you remember this. Yeah, people may forget what is what to do what. They may have something like a pen and they don't know what this one is for, what to do with the pens, for example. And social cognitions. I have Archimedes over here to show you. Normally, if we find out something interesting, we don't jump out of the bathtub and go running naked, right? So, but people with memory, with dementia, they may do something normally we not do. Okay, and the next set of question is to rule in, like to view a better case of the condition patient has, or to rule out, try to figure out certain condition is not. So that is the next group of questions we're gonna ask. And also the other group of questions we ask for the baseline of the patients. This not help to diagnose the conditions, but help to monitor the conditions, and also help to help them organize their life, help the family to provide a better, safer environment for the patients. This one slide here to just to remind you to talk to the elders. We may need to pay a little bit more attention to how to really communicate with the elders. So far, we help you ask proper questions to get good information, right? But now it's more than that. You have to ask someone who may have problem with attention, problem with memory, problem with hearing, to hear you and give you proper answer. So make sure you follow the instruction over here. Speak slower, clearer, nice and short, and hopefully you get the information, the correct information you would like to get from them. All right, this is the last slide. Any questions? If you don't have question, let me ask you, do you have any family members with dementia? Anyone have family member with dementia? I do, so don't be shy. Yeah. Okay. Yeah.
Yes, I have. Yeah, my grandmother has dementia. Yeah. She is 95 she's 95 year old this year. Yeah, and she get dementia for like more than 5 years, and everything daily activity she need help. Yeah.
Okay. Okay. But she, yeah, by the age, by the stories, I just from guessing and by statistic, I just guess likely she have Alzheimer dementia. I hope I'm right.
I think she get diabetes for a long time, but she didn't receive appropriate treatment. So I think maybe the nerve, yeah, her brain, the nerve get um, impacted from diabetes, and she lost memory gradually. Yeah.
Okay. Yeah. So yeah, we already said that earlier that diabetes is one of the risk factor, right? And diabetes tend to affect initially the small vessel, and the brain have large small vessel, so it's easily get affect the brain and cause atrophy over there. But I believe she may get pretty good care because after 5 years and still depends on other and she's still living and thriving. So you gotta take really good care of her. That.
Yeah, she become a very yeah. She has good sense of humor, and she yeah, she cry every day. Yeah, she cry a lot, and she sing all day. Yeah.
Oh, that's so nice. That's so nice of you. Thank you for sharing the story. Um, so the next one, do you think you yourselves ever get dementia? Yes and no, and why? Why yes or why no? Anyone? One last minute. Okay, we can share that later on if you would like to. Just think about that. You can post this on our Facebook. My time is up, so let me give the room back to the TAs, and you can go to the practice. I list some resources over here for you to check it out, and I will post the PDF file of the review of the dementia for you to read more if you would like to later on. Yeah, yes, Helen.
Great. Hello, Ming. I will share my screen just for a moment to make a couple of announcements. So, you guys can see my screen, right? Yes.